frequently asked questions, kind of jog your memory. So I'll just start that now. All right, so hopefully I didn't give you guys anxiety playing that video, but so those are just some questions, you can ask yourself, and you're probably even thinking already as you're going through dental school or getting ready to graduate. So I'm going to let Dr. Nichols introduce herself. If you could just give us, a brief background of, when you graduated from MUSC up to, where you are now and how everything's going.
Okay. My name is Dr. Stephanie Nichols. I graduated from USC in 2000. From there, I joined the Air Force, and I was a captain there for 4 years in the dental corps. After I separated from there, I actually started a family, and I stayed in the DC area and opened up my own private practice. I had that for about 13 years. And then I decided, hey, it's time to move back home. So that's when I found Aspen. And I've actually been with them for about 6 years. And from there, they saw my experience and they let me on a couple of practices.
That's
But
awesome.
as far as working with them, it's been I wish I had found them earlier. I've enjoyed pretty much every day. I get better and better.
That's awesome. So
Mhm.
you guys will probably see me looking around, and that's just me reading the questions that you guys are submitting. And some of you have already submitted them, which is great. Again, at the bottom of the screen, there's a little box that says Q&A. You can submit your questions there for me to ask Dr. Nichols. But we're going to go ahead and start off with the first one that was submitted. What was your journey to becoming a practice owner? So I know you kind of went over that. Kind of went into the Air Force, private practice for 13 years, and then now you're at Aspen with 3 practices. Is there anything you kind of want to elaborate in terms of what the journey looked like for you, or?
Well, when I came to Aspen, I was already experienced. That's the thing. But I was just looking to work and just just continue my dental journey on. I wasn't really looking for anything but an associateship, honestly. So when I got here, that's what I did. I supported whoever was the director, but they saw how I was organizing everything and keeping the staff happy, and they just offered me. They just said, "Hey, would you like to become MCD, which is a medical clinical director? So you manage everything clinical." So of course I've done that. I had a private practice, so it was easy. Then after that, they were like, "Okay, you're doing such a good job." So it actually I started owning in about a year when I started.
Wow.
Yeah,
So that's
but
pretty quick for those of you that are not super familiar with the process. You typically start off as an associate. However, if you're experienced, you have the ability to start as an MCD. And I've even seen students actually start as MCDs. It really just depends. And again, MCD is a managing clinical director. And that's really just like a fancy term for lead dentist. That's the best way I would put it. But awesome. So the next question that was following that is asking, what do you do outside of clinic to make sure your practice is running smoothly?
outside of clinic to
Yeah.
make sure, well, you know what? I I'm assuming you're referring to maybe continuing education. I'm assuming
Sure, we can go
that
there.
that that'll make your make you more efficient, and if you keep up with what's trendy, and you can serve your patients well, i.e. implants or CAD CAM or anything like that. Yeah, I
Okay,
do that. Mhm.
gotcha. So another good question here. Um, so you're owning three practices now. So it looks like they're asking, like, would you be able to own three private practices? Why didn't you choose to own three private practices versus three Aspen Dental practices?
You know what? The way Aspen is run, they make it a little bit easier as far as the business side. I think they take the work out of the work, if you understand what I'm saying. It's you get to focus on doing dentistry while they're doing the accounting, and you just don't have to worry about your bills being paid, and that's a big issue when you're out there by yourself. You have to be the accountant and the dentist and the recruiter and the human resources, and you don't have to do all that. You get to focus on dentistry, and I think it's the best equation to own in a practice, I think.
Yeah. Because I know obviously dental school doesn't teach you how to run a business. And at the end of the
No.
day, or, you know, owning a practice, you have to know how to run a business. That's awesome. So the next question here is asking, what does your day-to-day look like?
Day to day, I come in, you my patients are on the schedule. I actually go through the schedule a week in advance. I look at my patients, I know what I'm doing next week. I know why they're coming, when they're coming, what's next for them. It's still a lot. It's still you still have to put in the work when your patients come. Don't just come and just, okay, the patient's on the schedule, they're showing up, go work. No, you got to know what you're doing day to day. So,
Absolutely.
mhm.
Um, so somebody else is asking, what was your experience like when starting a family and working? So I guess the work-life balance.
You know what? It'll make you a true manager, because it's you do have to juggle a lot. It's hard having kids and owning your own practice. I'm not gonna lie, but if you're doing the private practice instead of Aspen, it's 10 times harder. As as a, I can only speak as a woman. It's hard.
Yeah, absolutely.
Mhm.
Um, okay, so the next question here is saying, how do you prepare during dental school to make yourself a good candidate for joining corporate or a private practice as an associate right after graduation?
You know what? I don't think you can only you have requirements that you're supposed to have before you graduate. That's the only preparation you're required to have. There's nothing that's going to prepare you other than wanting to learn more, be open to, just new things, learning from whoever you're working with. But there's no set thing that you can be ready for. Whether you go into the military, Aspen, private practice, it's like once you get in there, that's where the learning starts, and that's where preparation starts. So you got to be in the mindset of,
Yeah,
okay, now I'm ready to learn, not I
yeah,
know everything. Yeah.
absolutely. And another owner, actually, Dr. Christie, he always tells me, the best way you're going to learn is by doing more, just doing more. And that's how you're going to
Mhm.
get better practicing, right? Practice makes perfect.
Mhm.
And 100% every area. Um, okay, so this next question is going a little bit more into finances. How much is a good salary or good range salary wise for that first year out of dental school? What should we expect? So I know this will vary.
If you're getting paid by the day, I think a good salary is between 500 to 650 a day, plus any type of production percentage. Yeah.
Yeah, and that's
A lot
exactly
of,
what our system
a
looks
lot
like.
of, if you go out in private practice, a lot of these dentists will only give you like percentage on collection, and they're smart. They will set that number just high enough to where you can't really reach it.
Yeah. Yeah.
Hmm.
And that's honestly a shame to
It's a
hear.
business. It's business.
It is a business. Yeah, but it makes it tough because, like, I'm just speaking from what I've heard from dental students that I've had go into private practice that I've talked to, that
Hmm.
a lot of the time they're seeing only specific cases and the owner's doing
Exactly.
a lot more of
Exactly.
the higher producing cases. And that can limit you in terms of growing as a dentist clinically. So,
Yeah.
obviously, whether you work for Aspen, private practice, wherever, make sure as students, during your interviews, you ask these questions like, what kind of cases am I going to be seeing realistically? Like, that is important. That's where you're going to grow, and not even grow, but like,
Exactly.
obviously you want to make money for the work you're doing. So,
Mhm.
um, I just wanted to make sure, you guys have a good understanding of that. Um, but let's go into the next question here. If you were back in dental school, what would you have done differently?
Mm.
An interesting
You know what?
question.
Now MUSC is offering implant education, and we didn't have that.
Yeah.
So definitely that. Uh, I would have definitely took advantage of that, and I would have done more oral surgery. I would have done that. I've learned a lot now, but back then I probably would have, because in my, I automatically thought, oh, that I may not want to do that because it looks too hard sometimes. But yeah, I would have done
Yeah.
oral surgery and implants.
Okay. Gotcha. Yeah. Got to grow outside your comfort zone, right? So,
Yeah.
um, all right. So this one is about the interview process. What are some good questions to ask during an interview? So Dr. Nichols does all her hiring and firing for her practices because she's the owner. But, what are some good questions that you would like to, what would kind of differentiate a candidate just by their questions to you or that has already?
You know what? With my experience with interviewing, and I'm just going to be honest, you can ask the right questions, you can answer correctly, you can make it sound good, but until I see you work and how you're able to, ask the right questions then, and then learn from whatever you've asked, or if I'm coming in there and I'm answering your question and you go, okay, well, next time we'll do this. I just want somebody who's willing to learn.
Yeah.
That's all. It's really, to me, until I see them work, that's big.
Yeah, absolutely. All right, so just really quick, I saw some more people jump on. Those of you that don't know or haven't, done an Ask Me Anything before, at the bottom of the screen it says Q&A. You can click on that and you can submit your questions there. Again, you're able to ask whatever you want, right? Ask me anything. All right, let's go right back into it. So, how do contracts work with Aspen Dental? Do you have to work a certain amount of years at Aspen Dental before you work at a private practice? Interesting.
What do you mean work at a private practice?
I don't know. It's a
I
confusing
don't
question.
understand.
Let's start with the first one. How do contracts work with Aspen Dental?
Well, our contract is pretty, it's not binding. I mean, I could, if you can go when you want, if it's not for you, but as far as like contracts go, that's a broad question.
Yeah, but I think the biggest thing or the
They don't
biggest,
just
I guess,
lay out pay and all.
yeah, yeah. I mean, it has all of those things in there, but the way
Yeah,
it's not really a contract. We call them
yeah, it's like
letters, agreement.
yeah, yeah.
We
Like, do
call
we
them,
agree on this pay? Do we agree on these days, these hours, that type of thing?
yeah. So it's really an agreement. It's not like legally binding.
No.
Um, but yeah, so that's as simple as I can make it. It's not legally binding. If you're not happy there, obviously it is courtesy to let the owner know that you're not happy and you're wanting to leave, but there's nothing forcing you to stay there. There's no like restrictive covenant saying you can't work this many miles away from this practice. I know that's something that's asked to me a lot, so I want to make sure you guys are aware of that. That doesn't happen. But that's a good question. Let's see. Let's go to the next one. How does Aspen differ from other corporate dental offices? This is a tough one.
That
I
is a
don't know
tough
if
one
you,
because this is the only one I know.
Yeah, I know that's something that's asked a lot too. I don't know either because I don't know how Heartland or Pacific do their thing.
Yeah, I have no idea.
All right,
I
let's
just know
go.
this is a good one. I'm happy with this one.
Yeah.
Yeah.
Do you feel you've grown as a dentist since joining Aspen?
I'm gonna say yes, especially oral surgery. Yes, I have. Now
Okay.
I can pretty much, I'm confident to take out any tooth, uh, even tori removal. I mean, and this is something that I've, just like you said, Dr. Christie said, the more you do, the more comfortable you'll be. That's exactly what happened.
Yeah,
Yeah.
absolutely.
So yeah. Mhm.
Um, so somebody's asking, is mentorship important to you? And if so, how did that play into your decision to choose Aspen?
I didn't choose Aspen for mentorship, but I think it's important for a new grad to have mentorship. Um, I, I think you need to rely on your knowledge and maybe somebody who's been doing it for a while to just, bounce questions off of and see how they're doing it since they've been doing it for 20 some years. I think it's important.
Yeah,
Yeah.
absolutely. And that's honestly what I preach too. Like the transition and being able to know what a day to day looks like in an actual office is important. And being able to handle that schedule, that new schedule that you get is also important. And being able to have somebody kind of there to lean on all the time is huge, right? Until you kind of get your feet under you, get comfortable, and then you continue to grow from there. Um, all right, very simple question. How do you own multiple practices?
Well, it's only if you want to. You can own one and be happy with one. But if you feel like, hey, I want to, spread my expertise, to another and take on that responsibility, then if you have the time, because it does take time, part of your day, decisions you make for all practices. If you can do it, then you can. They make it easy for you.
Yeah, absolutely. I
Yeah.
mean, there's some docs that ask me to own double digits in terms of the practices, in the
Hmm.
20s, and it's
Hmm.
crazy. But it really is just the fact that, and I don't want to talk too much, sorry, but I've heard from other owners saying they kind of build each practice up. They build a leader in the practice and kind of covers itself, and they kind of go from there. Um, but that's a good question. We'll go straight into the next one. What has helped you the most with treatment acceptance?
You know what? The ability to talk to people. Honestly, it's that simple. If, and I think it just comes from uh, just seeing patients for years. Anybody who sits in front of you, you're able to relate, talk about anything. Just talk to them like they're related to you, really. You just explain fully and tell them why, they'll accept it. They will. And if they don't, at least they know why.
Yeah. All right. What was the hardest thing for you to adjust to when you started at a practice? So, I mean, you went to the Air Force, which is a little bit different, but
Uh-huh.
I
You
guess you
know
can
what?
explain
Honestly,
some hardships after.
what was the question? One
What
more
was the
time.
hardest thing for you to adjust to when you started at a practice?
When I started, are they talking about Aspen? The hardest thing?
Sure.
Honest, you know what? Okay, let me see. The hardest thing. I can almost relate it to the hardest thing of owning multiple. Because one, you got a handle on, you can make those decisions, everything's good. It's when you own another, it's different personalities. Get, Getting everybody to get along, just staffing. That's to me. That's the biggest thing.
Yeah, the leadership part and
Uh-huh.
managing people, that can be tough. People are
Managing
difficult.
people is the toughest. Patients are easy. Staff is hard.
All right. So the next question here is asking, what do dentists say is the best thing about working for Aspen Dental? Also, what do they say is the worst thing about working for Aspen Dental?
Shoot, the best thing. Man, to
First thing that
me,
comes to your mind.
The best thing is, I mean, for me, handling my own business side on the practice side, if they could handle that, that was the best thing. If I could just hand that off, I was great. Even human resources, the help with hiring, that helps a lot. The worst, you know what? I mean, I'm not just saying it. I don't really complain about Aspen. There's nothing, because this right here, whatever you're going to have that you think is the worst, you're going to have somewhere else too. It's not like it's going to be unique to Aspen. It's when you deal with people, you're going to have some obstacles. Just with anything, patients, staff, different personalities, you're going to have that anywhere. So I can't, whatever complaint you would have with one, it's not unique to just Aspen.
Yeah,
Yeah.
100%.
Yeah.
Um, so somebody's asking, what are your future plans with dentistry? It's a pretty broad question, but I guess you
You
can
know
answer it
what?
however you like.
Well, I'm going to open up one more. That's my goal. Other than that, just trying to find someone to come and associate here in West Virginia so I can hopefully kind of go and mentor my other doctors the way I want to.
Yeah. Okay. Um, all right, we'll go to the next one. What does it look like for a new grad starting at Aspen?
Look like. Well, I think you have a lot of learning and you start off as an associate. There's a lot of learning.
Mm-hmm.
But I think you'll increase your efficiency. You'll get used to seeing more patients. Uh, I think you'll grow, basically.
Yeah, absolutely. And just to piggyback off of that, as soon as a new grad joins, and some of you may know this already, you guys go through like a 4-week mentorship or onboarding process where you're assigned a mentor and you're working with that mentor closely throughout those 4 years, kind of figuring out your speed for certain things. You'll be doing a lot of shadowing in the beginning. And correct me if I'm wrong, but what is your first month for an associate look like for you? If you could paint that picture.
Well, I think they go to a different practice and they shadow another dentist for about 4 weeks. They learn just the way Aspen runs, the computer system, just the logistics of everything first before they're thrown in
Mm-hmm.
to see patients at the practice that they're going to be at.
Mm-hmm.
Mhm.
Are they ever on their own as an associate? But I mean, I know some owners are able to mentor in their own practices and some are not
Yeah,
able to. So it kind of depends. So you
it
never know.
depends. Depends on what license they have and where they want where there's room.
Yeah.
Hmm.
All right. And there's another question on top of that. Did you have a good experience? So you personally, starting at Aspen.
Did I have a good experience?
Yeah.
Of course, I stayed. Hmm. Yeah.
um, Also, did you feel supported? There's three in one.
I did. I did. I felt that even when I did the training, I went to Kentucky for the training. There was a doctor there that was showing me around. Yeah, I could call him anytime and ask him anything. Yeah.
Awesome. Um, okay, so what does the tech look like in the offices? So I'm assuming technology. What kind of
Uh, we
equipment?
we have scanners instead of impressions for crowns. I think we're scanning for dentures too now. Invisalign. I mean, it's basically all about the scanning. We have a oh my gosh, cone beam X-ray
Hmm.
for implants. Yeah,
Yeah,
Aspen is
so
pretty.
I know moving forward, every practice is already coming so all the practices are built from the ground up for those of you that don't know. So we don't acquire any others. We find a location and then we build it. So all the new locations are coming with CBCTs and iTero scanners. Sorry, blanked for a second. But that is something that is standard from now on. And then if there's any other pieces of technology you're wanting to put in the office, it's up to the owner. Um, if that's something that you're looking for. All right. The next question here is asking, what were you looking for in your first job as a dentist?
Just more experience. I knew I needed it. I wasn't sure, so that's why I joined the military.
Mm-hmm.
Yeah, that was the main thing. I just knew I wasn't ready to be the leader of a practice.
Yeah. Yeah, it takes time, of course. All right, next question is asking, what was your perspective of DSOs while at MUSC? It's an interesting one.
I didn't have a negative view. I didn't have any view. They didn't really tell us to have a certain view. I don't know if they're doing anything different now, but they didn't.
Yeah. There's a few things that I have heard. The contract thing that we already went over, the restrictive covenant. And I know there's always things with treatment planning gets tricky. Students always think that they're not able to treatment plan if they're working for a DSO. And I can't speak for all DSOs. So it'll be, up to the no, I mean, 100%, like you're always able to treatment plan. It's your license, it's your
Exactly.
liability. But Dr. Nichols, is there anything you want to talk about in terms of what treatment planning looks like for an associate?
You know what? When you start, you're still going to need that mentorship. So it's not that, you treatment plan something and I go change it. You know, we'll sit there, we'll talk about if I see something or think you missed something, or is there something that you could have done, just maybe looked at, or possibilities for the patient. We'll go over that. But as far as, you have to do this, no, there's none of that.
Yeah, I know that's something that is always in the back of students' minds. So that's something, and I think if students knew that they're in charge of everything that they do in the practice,
Mhm.
a lot of people would have a different perspective, and would have a better understanding. Um, but that's another good question. So,
Right.
how many patients do you see per day? How many do your associates see per day?
Well, my associates, of course, you want to work them in a little slower. Now, as far as I'm concerned, I push myself to do more, but that's just my personality. So as far as patients a day, I can see anywhere from, and I don't know if you want to know the number, but it could be anywhere from about 30 to 40. But that's just me.
Hmm.
I'm not going to say, oh, okay, associate, you're going to do what I do.
Right.
This is 21 years of experience, so it's different than coming out of school. I don't want to overwhelm an associate. I'm gonna give them what they think they can handle, and if they feel like they can do more, then we'll let you do more.
Yeah, absolutely.
Mhm.
Awesome. Um, did becoming a practice owner reach your expectations? I'm guessing so.
Yeah, I would say so.
Is there anything you want to elaborate on that in terms of like, probably what were your expectations?
You know what? After running just one, but I was doing I had like 10 hats on. You know, Now that I can focus on the dentistry, and I do make some administrative decisions, but it's not a lot. It's not a lot. You can do more, or there's managers too that can help you out as well. So, eh, what was the last part of that question?
Did becoming a practice owner reach your expectations?
I think it exceeded, actually, and I'm not just saying that. I think financially, it puts you in a better position to be under Aspen and own a practice
Yeah.
than actual private practice. I think so.
Yeah.
That's been my experience. Hmm.
No bias here, right?
No,
I'm just
no.
kidding. How is your work-life balance owning three, almost four practices and being a mother?
You know what? Like I said, I'm one of those people that
Yeah.
like to be busy, and I like having multiple things to do. So, do I juggle it well? I think so. I mean, now my kids are in college, so I don't have to do a lot like they if they were at home. But
Yeah.
3 practices, it keeps me busy. And I think that's why I went to 3, just so I could be busier after
Yeah.
they left, you know.
Wow. You're superwoman, huh?
I, I guess so.
All right. The next question here, this is a good one. What are the advancement opportunities at Aspen? So we did kind of go over a little bit. So I guess if you could just elaborate what that journey looks like.
Advancement opportunities. Is that as far as ownership or?
I guess just from, day one associate to the possibilities up until where you are, ownership. Yeah.
I guess as your experience increases, the sky's the limit. I'm thinking. I mean, they don't they don't what is it, stop you from uh, owning. There's no set number. I don't think.
Yeah.
Yeah.
Yeah. So I guess just in terms of like going from associate to MCD to partner or even owner,
Uh-huh.
what does that look like for, I guess, when is an associate ready to be, a lead dentist, or when would you promote an associate to an MCD and the
You know
partnership?
what? it, there's no set time for that either. I mean,
Yeah.
if somebody comes in and they pick up, they do more, they learn more, they're becoming more experienced. They sit me down, they go, "Hey, I think I'm ready." As you can see, I've done this, 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 and this. I mean, there's no real time limit on that. There's no
Yeah.
time set. You
I know
know.
everybody kind of has a different
Yeah.
time frame and when they're ready, of course. But yeah, I mean that's the best way I answer it too when students ask me is, it's really when you're ready.
Yeah.
Do you wait until the associates ask you for like promotions, or do you kind of know?
No, no,
No.
I would know. I would know.
Yeah. Okay. Um, so the next question here is very simple. Why did you go into dentistry? It's a good question.
Wow, that is a good question. I wanted to be in healthcare. I knew that early on. I just didn't think about dentistry, honestly. I was like, okay, I want to be a doctor. That's what I want to do. So when I started in undergrad at LSU, that's what I was doing. I was pre med. That's what I was doing. But I
Yeah.
would go to a lot of summer programs and follow different doctors in my free time. But as I did that more, I kind of was I said, well, maybe there's a different aspect to healthcare. I wanted because it just wasn't that interesting to me.
Hmm.
So, guidance counselors and here and there, they go, well, think about dentistry. So when I did, I was like, okay, that's what I'll do. So, once I got into it, I feel that was the place for me. Hmm.
Absolutely.
Hmm.
Um, so how was your transition from, a fourth year at MUSC and then to a licensed practicing dentist for the Air Force? And then did you feel well prepared? And then what were some challenges you faced? So you got three. We'll go with one. How was your transition from student dentist to a licensed practicing dentist in the Air Force?
It was, you know what? The reason why I picked the Air Force is because I had no other avenues. I didn't feel I could buy a practice at that time. And the recruiter was a good one. He said, okay, come on in here. You can get your experience. I didn't know what I knew when I left MUSC, which nobody does. You're like, oh, okay, I'm a dentist. Now what? So I just decided to go the Air Force Avenue. And once I got in there, I did feel like I was more qualified than the job I was doing, honestly. That's just truthful. So I was already signed up, so I just finished what my commission, and then I knew I was going to get out and try to go to private practice. So
Absolutely.
I
Awesome.
was, I thought I was overqualified. Yeah.
Okay. Um, I guess, what were the challenges you faced while you were in the Air Force? What was tough about it for you?
Well, yeah, it's not only being a dentist in the military, you are a soldier. So you do have to go wherever they say they want you. and then there's the possibility of war. And you have to know it's more of 75% soldier, 25% dentist. So that was an obstacle for me because I wasn't that military minded. So, so just being honest.
Yeah.
So um, I thought that was a drawback for me, you know. I
Yeah.
was like, oh yeah, wait a minute, I'm in the military, and I was in there during 9/11, so I was really like, okay, it's real, it's real.
Yeah. I'm sure that was
Uh,
scary, but that's awesome though, to say, you went through that. It's a great experience, and, I'm sure you learned a lot from it.
yeah, I did.
Awesome. Um, so we'll go right into the next one. Somebody's asking, do you recommend going into a GPR or straight into an associate role?
You know what? I'm gonna be honest. I think you should go GPR just for more experience. It doesn't hurt. Um, but if you can't, of course, associateship.
Yeah. Yeah. So it really just, again, like she said, it depends on kind of the person you are and how you feel. And,
Mhm.
you guys asking Dr. Nichols questions, if you're prepared, will definitely be huge for you guys. But we'll go right into the next question here. Um, what options did you look into coming out of school, and then why did you end up choosing the Air Force?
Because they were giving me money.
Fair enough.
They waved money in my face, and I said, okay, I will try that. Yes, I will do it. So, um, but yeah, basically, I wasn't going to I didn't think, I wanted the experience. I really did. And I thought I would get more in the military. I thought I would, but in actuality, you don't. Most of those soldiers are healthy. Um, they bring them to health, and you're pretty much doing periodic exam. They may need a filling here, filling there. It wasn't a lot. I had a lot of free time in the military.
Okay. All
Yeah.
right. I hear you. All right. Somebody's interested in implants. How often are you performing implant cases?
You know what? I restore implants, but in about 3 months, I'll be placing them.
Awesome.
Hmm. But I've been
And is
restoring
that,
them. Hmm.
are you taking the course through Aspen,
Hmm.
or the implant
Yeah.
training course?
Uh-huh. I am.
Yeah, so guys, this is something that just recently came out, actually last February. So we actually have I can't remember his name, Dr. Sandeep Rawal. He's in charge of the implant training course as well as some others. But making sure that you guys are prepared for placing implants in the future, if that's something that you're wanting to do. But Dr. Nichols, what does that look like in terms of, let's say you have an associate that's wanting to, get better and be able to place implants? Like, how do you have that conversation with them?
What, as far as them taking the class?
Yeah.
I mean, they can take the class when they want. I mean, there's no, you don't have to, there's no prerequisites to take the class.
Yeah.
Yeah.
Um, so like she said, if you guys are in a position where you're wanting to do Invisalign and you're working in Aspen practice, you have that ability to register for those CE courses and take
Yeah.
those. Same with implants, same with like a lot of things actually. Um, so we actually have a whole library, and I'm sure some of you have actually seen this already, from previous AMAs that I've done. If not, I'm going to share my screen really quickly and show you. Um, So this website here, aspendentalce.com/welcome, there's a whole library of free CE courses on there that you guys can take at any point in time, even if you're not working for an Aspen practice. And you can share this amongst, family and friends if you want to. But it is a, cool opportunity if you're, this summer wanting to take more CE courses or interested in something. I recommend you go through the library, see what's available. But just wanted to share that with you guys. But we'll go right into the next question. Let's see. How do we take advantage of tuition reimbursement opportunities? Dr. Nichols, I don't know if you have any, do you?
Uh, Not at the moment, but we can.
Okay.
Yeah.
So guys, the way tuition reimbursement works is every owner makes that decision on their own. You'll typically see tuition reimbursement opportunities in harder to fill locations, places where a lot of people don't want to go. Um, However, again, I always tell all the students this, the main important thing, your priority should be mentorship, getting through that transition of going into an office of practice and getting comfortable seeing multiple patients, working with others. And obviously you guys are doing a lot of that in clinic, but that transition's huge. Another question here is asking, what does the patient demographic look like for you?
Oh, I mean, I see it's just like any other private practice, age 4 and up, um, all different races, and just your average patient. I mean, there's no not it's not just older people and dentures. I think and a lot of people think Aspen is like that. No, it's just general dentistry or
Yeah.
all types of patients.
What would you say, mostly fills up your schedule, I guess? Or is
Right
it,
now, it's just a mix. I don't have just dentures or fillings or crowns. It's literally a mix
yeah. Okay.
of everything.
Um, so the next question here is asking, what does a new dentist find frustrating?
I think they find it frustrating that they're not fast enough.
Okay.
And yeah, and sometimes denture steps, because dentures aren't really pushed or you don't have a lot of requirement in school. So you might get a little frustrated by not knowing what to do, or maybe you do something and a patient doesn't like it. So just dealing with, that type of thing, all different personalities and patients, and thinking you have to do everything right, that gets a little frustrating.
Yeah, absolutely. Because you're not going to have it right coming straight out of school, right? So it does take
Uh,
time. Um, okay, next question here is, how involved are you in the business aspect of the practice?
you know what? You're aware of the business side, as far as like questions and decisions on it could be from financial things with patients, uh, as far as anything financial, you do have a say in.
Hmm.
Hiring, you have a say in. Is the business side, when I say they take care of it, it's just the accounting portion, like the paying taxes and all of that, paying employees,
Yeah.
that type of thing.
Um, awesome. So the next question here is, sorry, I missed it. Somebody's asking, what do the hours look like and how long can you expect to work as an associate at Aspen?
Well, Aspen, our biggest thing is access to care. So we like to be open for our patients. We do about 9 hours a day, and there's a late day to where we come in later and we leave a little later, and some Saturdays.
Okay. Yeah. So guys, the hours will vary. Um, Depending on the practice, depending on the owner, again, the owner has full say in terms of how the practice runs, and it's completely up to them. So it'll be up to you to ask the owner, what the hours are, what that looks like. Um, Somebody's asking, when can I cop that Aspen swag? We actually have a vibe event coming up. And if you are looking for Aspen swag, I believe they're giving out more during our vibe event. If you're a D4, I would definitely recommend you join or you register for this event. It's going to be on the 22nd of April. Here, I'll put it up on the screen here so you can see it. But yeah, I believe we're sending a swag box to everybody that joins. You do have to be a D4, able to interview. But, I always recommend you interview, because why not? Right? You have an opportunity to meet a new owner, hear their story, and just get practice interviewing. If you haven't interviewed before, there's Aspen swag that you can look forward to. So it's right up there on the screen, aspendentaljob.info/April vibe. It is case sensitive as well. So if you do go to that website, I'll send it out to everybody too. But it's an opportunity for you guys just to learn a lot more. Usually we do these in person, and they're pretty like full-on productions that Aspen puts on. Hopefully we'll be going back to that soon, where we can fly some of you out somewhere nice, and you'll actually get to meet a lot of these docs and owners and people in person, and you can get to meet them in person and learn more. But yeah, so if you're a D4 interested in learning more and wanting to interview, I would highly recommend you sign up for this on April 22nd. But yeah, so we'll go straight into the next question here. I know there's a few about pandemics, of course. What have been some of your biggest obstacles during the pandemic?
I would say making it more comfortable for the staff, honestly, because we're the ones seeing a lot of people. You're going to have some people that come in that will be honest. Yes, I've had it. I may have it. You're going to get the ones that, nope, I don't have it, because they're in pain and they want to be seen.
Yeah.
So you have to treat everybody like they have it. So just getting my staff to feel comfortable about being here for the patients, that was my biggest obstacle. But you got to be confident and reassuring to them and tell them, hey, educate them on what it actually is and how you can prevent it. It's that was my biggest.
Yeah, absolutely. And I know everybody, in terms of like the practice owners, we made sure like the PPP loan was passed for all of you guys. You guys were able to apply for it,
Yeah.
get the money you needed to take care of your staff and your office. That was huge. So the fact that another, interesting fact here is that fact that, Aspen Dental allows our practice owners to own the practice is the reason why that PPP loan was approved for all the practices at Aspen Dental. Because you are all the owners of the practices. Every other DSO was not able to apply for that loan, just because the actual corporation owned it and not the dentist in the practice. So if there's one thing I know, that was one thing that other DSOs are not doing. But again, that's just to my knowledge. That's what I heard. But we'll go straight into the next one. Somebody's asking, charity and giving back is something that's important to me as a dentist. Does Aspen provide any opportunities for that?
You know what we do? We do a lot of that. I mean, we go out of the country and we see patients. We do things. We have different events for our veterans in the area. We have one, actually a day where we actually service our vets for free, and we have mobile. Was that mobile dentistry? We
Yeah.
do. We saw vets then too, but then they go overseas. I forgot what they call that. They actually do a mission over there too.
Yeah, so we actually have a whole team that is just focused on that, focused on setting up kind of mission trips. And this is an opportunity to give back to communities in different areas of the world, as well as get practice in terms of your clinical ability. So I know Dr. Christie, for example, took a bunch of his docs down to, I can't remember what country. It was a South American country, just to do a bunch of implants, to get implant training and to learn more about how to do that, and more extractions for his associates that need more, help with that. So, they're always figuring out ways to give back, which is cool. The healthy mouth movement is something that we do, which I actually have a video I'll share quickly. It's a short one. but it does a much better job at painting the picture than I can. So I'll share my screen here.
A very special day for veterans.
Today, Aspen Dental is doing what they can to help bring care to veterans who need it.
Aspen Dental.
Aspen Dental opened nearly 500 of its offices this weekend. Today, Aspen Dental's offices are offering free care. It's all part
Oops, sorry guys, I was on mute the whole time. So that RV you see behind Dr. Amadawami here is an actual, almost like a little mini office. This mouthmobile is what it's called. It travels all across the US and it parks in like rural areas, and local Aspen doctors actually come and serve patients in their community for free. And these are veterans that they're serving. But they broadcast it everywhere on news channels to get, veterans out there who are not able to get into the VA, or because I know I've heard that can be, very hard to get into. But it's just a cool opportunity that I want to share with you guys that Aspen does. Yeah. So have you been on the Mouthmobile before, Dr. Nichols?
Yes, in Charleston, West
Yeah.
Virginia.
Okay. Gotcha. Yeah, I got a chance to see it too. I think there's like 2 operatories in there. Yeah, it's like a full-on little mini dental clinic.
Exactly. 3 operatories, X-ray unit, sterilization area.
Yeah.
Yes,
Yeah. So I do want to be mindful of your time. I know I can, obviously you're still in your practice. You have, to go home at some point, but is there anything in closing you want to say to the students? And those of you students that want to submit last minute questions, now would be your time to do so. But again, if there's anything in closing, Dr. Nichols, go right ahead.
Well, when you graduate, I just remember being like, oh my goodness, what am I going to do? I just want you to keep Aspen in mind. I mean, of course, I would love to have one of you, 1,000 of you guys working in my practices, because I'm just familiar with the school, and I have a very positive experience with the school, and I know what you know, because I came out knowing that. So I just want you to just keep Aspen in mind, because it's a good decision. I wish I knew about it when I was graduating, honestly, and I just wouldn't say that. I will tell you the truth.
Yeah,
So,
absolutely. It doesn't hurt just to, like I said, interview, meet, a practice owner, and, learn more. It doesn't hurt to learn more and about other opportunities. But I do want to show you guys just this screen here. If you do have any questions or want to reach out to me, you want to shadow a practice, whatever it is, you're wanting to do, or if you have more questions, just reach out. My contact information is there. I put our dentist recruiter's name, email, and phone number on there too. She wanted me to, Nicole Lauer. Some of you guys may even know her or heard from her. Her contact info is right there. I'm always available. You can shoot me a text whenever, give me a call, send me an email. I'm very flexible. I'm happy to talk to you guys, give you advice, even if it may not be for an Aspen practice, wherever, just genuine advice. Like, reach out to me. I'd be happy to help you guys out. I'm sure Dr. Nichols wouldn't mind answering more questions if you want to send them my way too.
Sure.
Again, Dr. Nichols, thank you so much for hopping on and volunteering an hour of your time. Guys, I hope to see you in person shortly. You know, we're in a panorama or whatever it's called. But I hope you guys have a good night. Again, Dr. Nichols, thanks.
Oh,
For the
you're welcome. Thank
raffle,
you.
by the way, really quick, I'm sure that's why a lot of you guys registered as well. I will be announcing that probably tomorrow or the day after via email. So be on the lookout for that in terms of the winners for the raffle that I put on. But
Awesome.
other than that, take care, guys. I'll talk to you guys all soon.
All right. Thank you.
Yeah. Thanks, Dr. Nichols.
Bye.